and help sort it all out for us this morning. We're bringing in an expert, a cardiologist at Beaumont Health, Dr. Kavitha Chinnaiyan. Thank you so much for being with us this morning.
Thank you so much for having me.
Well, Dr. Chinnaiyan, have heart health issues worsened during the pandemic?
Yes, they have worsened, particularly in the last year because of delays in care. People have not wanted to go to the hospital and have had more complications from delayed presentation and lack of treatment. Yes.
So let's talk about how it manifests differently in men versus women, because I understand the symptoms can be very different.
Yeah, when we talk about heart disease, we are talking about coronary artery disease, which is the blockages in the heart arteries that cause heart attacks specifically. And a lot of women have very classic symptoms, which is the crushing chest pain and so on. But when we talk about non-classical symptoms, they tend to be more common in women, such as shortness of breath, feeling tired, having jaw pain, back pain, things that you wouldn't normally attribute to heart disease. So those are more common in women.
Right, shortness of breath. I mean, some people get that just walking up the stairs.
Exactly.
And then back pain, you're thinking, how is that associated with the heart? So those are some of the non-classical symptoms we should look out for. What are the risk factors for women?
Yeah, there are some specific risk factors for women which we need to be aware of. The classical things like having high blood pressure, diabetes, and smoking, and so on. But specifically in women, also premature menopause, preterm labor, having inflammatory conditions like rheumatoid arthritis or lupus, and having depression. All of these things are more common in, obviously, the women specific things, and some of these conditions that are more common in women. Also having had breast cancer and having had chemotherapy or radiation therapy, all of these kinds of things put a higher risk kind of category for women.
So what can women do to combat this disease? What kind of health checkups should they be getting and asking for, and how often?
Yeah, so, the most important thing is to know your risk. And so, it's really good to kind of establish that maybe in your mid-30s, and then have an understanding of what your baseline risk is, including your family history and all that. And thereafter, when you start getting into your mid-50s, there are some specific types of tests we can do, such as a coronary artery calcium score, which gives us a very precise indication of risk for heart attacks and deaths from heart disease.
So your primary care physician should be able to get you on a path for what you need to do, when you need to have these checks done.
Absolutely.
All right, Dr. Kavitha Chinnaiyan from Beaumont Health, thank you so much for waking up with us and sharing your insight with us this morning.
Thank you.